So we'd be studying about gastroesophageal reflux disease. In this section, we'll be studying about the clinical symptoms that are usually present in a normal reflux disease patient and the related diseases, the differential diagnosis and the associated diseases of gastroesophageal reflux disease. So in this section, we'll be studying about the classical symptoms that a patient present in the outpatient department, and then the extra-esophageal manifestations, the symptoms that are not purely related to the esophagus, the symptoms that are present in other systems of the body, and then the differential diagnosis that a person can come up related to the reflux disease and the associated diseases. So we'd be studying first about the symptoms that are clearly related to the esophagus. So the esophageal syndrome, it has a symptomatic syndrome. We'd be studying about the typical reflux syndrome. In the typical reflux syndrome, you'll be having symptoms such as heartburn, odynophagia, regurgitation, dyspepsia, nausea, vomiting occasionally, and symptoms such as hiccups and burping. If we talk about the heartburn, heartburn is the most typical feature that a patient might come up with. It occurs as a burning sensation which is present in the stomach or the lower chest, and it causes a very irritated symptom. And the other thing that I would be studying about is the reflex chest pain syndrome, which is kindly typical of cardiac chest syndrome. For example, it mimics the angina pectoris, but it also has symptoms that would radiate. It has a very burning and a squeezing quality of a pain, and it radiates to the neck and to the jaw and to the arm, which is a typical of a which is a typical pain of angina. And the other syndrome with esophageal injury is the reflux esophagitis, reflux strictures, Barrett's esophagus, and the adenocarcinoma, which are typically the main complications that occur in a very serious reflux disease. So if we talk about the extra-esophageal syndrome, that means that the symptoms that is not purely related to the esophagus. Symptoms that could involve the other systems. If we talk about established association is the reflex cough. Reflex cough could occur if the gastric contents are being aspirated into the lungs, which causes bronchospasm, and then it could also cause the stimulation of a vasovagal reflex, and in return it may cause bronchoconstriction, which causes a cough. And then reflux laryngitis, we could, if we see it through an endoscopy, we could see that the larynx is being inflamed, it has edema, it has erythema, and the vocal cords may also have a few ulcers. Reflux asthma is the same as the cough. There might be a vasovagal stimulation and bronchoconstriction could occur. And reflex dental erosion. The reflux could be so severe that it could involve the dental, it could cause a dental erosion, and it could even cause the loss of the teeth structure. And the proposed associations, if we talk about it, it could involve the nose, it could involve the sinus and cause sinusitis, it could involve the lungs causing pulmonary fibrosis, pharynx could be involved, pharyngitis could occur, and it even could involve the ear causing recurrent otitis media. So if we talk about differential diagnosis, how there are different things that could be related to each other. You could it could be helped in differentiating the other diseases. If we talk about the gastrointestinal differential diagnosis, it could be of gastroenteritis, obstructive abdomen, it could be of gastritis, duodenitis, and peptic ulcer, which is really hard to differentiate from reflux disease. Dysmotility disorders, pyloric stenosis and volvulus, which are typically present in newborns, cyclic vomiting, and presence of a foreign body. And if we talk about the extra gastrointestinal symptoms, differential diagnosis, it could be of any infection, any respiratory or ENT malformation, any type of allergy, any neurological neuromuscular diseases, pancreatitis, anorexia, self-induced vomiting, and any cardiac disease, because it also has a mimicking angina pain, so we could differentiate it into cardiac disease too. So we talk about the associated conditions. What are the conditions that are present with the other diseases? For example, pregnancy. Pregnancy in pregnant women, 30 to 70% of women have reflux disease primarily in the first trimester. And scleroderma. Scleroderma is an autoimmune condition which has an esophageal dysmotility. It is also associated with reflux. Zollinger-Ellison syndrome is also an esophageal disorder. Post-Heller myotomy of eclasia. Heller myotomy is a treatment for eclasia. So after this procedure, reflux could also occur. Post-laparoscopic gastric binding. This laparoscopic gastric binding is usually for obese patients. So after this procedure, the patient might develop a gastroesophageal reflux disease. And finally, prolonged nasogastric tube intubation. For example, in coma patients, this tube that is present in the esophagus disrupts the function of the lower esophageal sphincter and does not let it function, the function that it causes the barrier function, and it does not let it to provide its function, and reflux disease could occur. Thank you for watching sqadia.com. Please keep watching the other sections related to this topic.